Greetings. My name is Dr. Kim DellAngela, and I'm on the faculty of the Chicago School of Professional Psychology's doctoral program in clinical psychology at the Chicago campus. I am really delighted that you are considering the Chicago School at the Chicago campus for your continuing education and your path to becoming a clinical psychologist. I have been at the Chicago School in many roles since 2011. I came here because of my attraction to the social justice mission and my belief in the values of the Chicago School, which include engagement in the community and social justice. I spent 20 years as a faculty member and as a clinical psychologist, primarily as a health psychologist, within a large academic medical center and on a medical school faculty. There I did work with autistic spectrum disorder, with pediatrics, with pain management, and working collaboratively with numerous teams, working on chronic health concerns and bringing psychology to the healthcare system. When I came to the Chicago School, I was delighted to be received into a faculty that had a diverse interest and were really interested in working in community. I teach primarily in areas of health psychology, including our course in primary care, which is using some cutting edge curriculum to prepare students to work in this area, which is becoming more and more important for our profession. I am deeply committed in a professional practice, and most of my courses include a deep discussion of how we work alongside our colleagues in all other professions in order to do our work with the most impact for our communities. There are other courses that I teach as well. The Advanced Practicum Seminars, of course, I teach every year. And in that, students who are finishing their last clinical training meet together in a seminar and we discuss complex issues of patient care, how we fit into those systems, and this is the last launching course into the internship as students are ready to take on the role of the clinical psychologist. I also teach courses in lifespan, and one of my particular favorites is the Foundations course, where I work with a small group of students, usually about 5, to develop a research project that prepares them for the dissertation that they will do in their last years of the program, and to learn how to present as a scholar at scientific conferences. This year, my group is working on telepsychology project, which was to be presented at the Midwest Psychological Association conference, and which we continue to work on in this current environment, which is really starting to appreciate the use of telepsychology, especially during crisis moments, and to reach people who otherwise can't be reached through our traditional ways of approaching treatment. Other passions I have include a full range of health psychology topics. I work on dissertations with students in chronic care, in traumatic brain injury, in sports psychology, and in all kinds of projects that involve media and technology in healthcare and in other aspects of the work of a clinical psychologist. If you have any additional questions of me about my research, about my practice, about my teaching, or about the Chicago School, I encourage you to reach out to me through the Chicago School website or your admission counselor. And I just want to say I'm delighted that you're considering this profession. I have had the opportunity to do so many things as a clinician, as a leader, as an administrator, as a researcher, and as a collaborator in many, many settings and with many colleagues. And I hope, regardless of what choices you make, that you will be able to appreciate this profession and the multiple ways that it is an enriching career.